Hi there, everybody, and thank you for joining us today for Just Ask Dr. Macie and Guest Live. We are streaming live on Facebook and also YouTube. So if you have any questions, comments, concerns that you want us to answer, just drop your questions, comments, concerns in the chat feature, and we'll respond to you as quickly as we can. The video will be available as a replay as well. So if you can't join us today, you'll always have the information made available to you. This platform is for anything health related. Health related concerns related to the senior population, the younger adult population, whomever, whatever, because we know the things that we do at a younger age absolutely sets the stage for how we're going to live in an older age. I'm Dr. Macie Smith. I am the host of Just Ask Dr. Macie and Guest. I am a social gerontologist and a licensed social worker. I pride myself on providing information, education, and training to help you and your families reach the next level of care. So, as many of you know by visiting and viewing my platform, I do specialize in working with those who have Alzheimer's disease and progressive types of dementia. So I think it's very important for us to better understand the whole umbrella term of what dementia is. And I also want to share with you that Alzheimer's disease is not the only type or the only cause of dementia. How many of you know that frontotemporal dementia is the number one type of dementia for those 60 years of age and younger? I know many of you probably didn't know that, but guess who does know that very, very well? Our guest today, Katie Zenger. So let me introduce you guys to Katie Zenger. Katie is the lead consultant for Zenger Strategies, LLC. It's a public health and strategic planning company based in Columbia, South Carolina. She has over a decade, well over 10 years of professional public health experience, and also serves as a senior associate with the prestigious Weathers Group. Hey, Katie girl, what's up?
Hi, so glad to be here, Dr. Macie. Thank you for having me.
I am so glad that you are here with us. So listen, many people know about Alzheimer's disease because that's the number one type or the number one cause of dementia. But when it comes to the other types of dementia and the other causes of dementia, there's not a lot of knowledge or not as much awareness as it is for Alzheimer's disease. And I reached out to you to talk to us about frontotemporal dementia because we typically do see that particular type of dementia for our younger population under the age of 60, which is typically early onset or younger onset dementia. So I'm excited that you're here. I know that you're going to speak in layman's terms to us. And this information will wholeheartedly, I'm telling you, will change the lives and the trajectory of the caregiving process for many of our individuals who are watching today and watching the replay. So tell us a little bit about Katie and Katie's connection to frontotemporal dementia.
Woo, love that big introduction. My name's Katie Zenger. I have a master's degree in public health, but more importantly, I am the South Carolina ambassador for the Association of Frontotemporal Degeneration. So it's a lot of stuff in the mouth to say that big acronym, but they are an incredible organization that I really couldn't have gone through this process of having a loved one with FTD or frontotemporal dementia, like you just mentioned. I wouldn't have been able to get through it without them. So I'm here today as a representative and a volunteer with the AFTD, or the Association for Frontotemporal Degeneration, which is like an umbrella term for a lot of different types of brain degeneration. Basically, it's the frontal and temporal lobe of your brain. That's what they're talking about when they say FTD, frontotemporal degeneration.
Thank you for pointing that out, because some people may be like, well, what is that? I mean, what part of the brain? And so, I mean, hey, that's back in what, biology? I mean, I know the brain is essential, but you know what I'm saying? It's a whole lot of parts and pieces that really make up your being, your brain, that is your being. So Katie, what is frontotemporal?
So this is, I actually have like a pre-veterinary medicine, like a biology degree from Clemson for my undergrad. But if you're not looking at that stuff every day, you don't think about, you're not like, oh, I know exactly what the hippocampus does. Like the normal person, even if you've gone through those classes, that's not something that's just like right here, the different parts of your brain and what they do. So I always think it's useful, especially when we're talking about FTD, to talk about the frontal and temporal lobe. So that frontal lobe is where what's called your like executive functioning works. It's where your personality lives. It's where when I say executive functioning, I mean, you know that you have to put your underwear on before you put your pants on, right? You have to put your socks on before your shoes.
Hopefully.
Well, I mean, if it's a style choice, I mean, do what you like. But like if on purpose you want to get dressed in the normal way, like that's something that you learn when you're young, right? That's an executive function. You know that you have to have steps in order. There are lots of different steps in order to just get dressed, right? And so what happens with frontotemporal dementia is that those pieces of like basic functioning start to disintegrate. And then they start to go away. So what's happening with the frontal and temporal lobes of the brain during this disease process is they're atrophying or shrinking. So you can literally see sometimes with the frontotemporal degeneration, you can see on an MRI the skull and then the brain and the skull just like becoming smaller and smaller in this front area.
Wow, shrinkage.
Right, it's like there's less of it to function, so it's not there. They can't do it. So unfortunately, because this is such a so many behaviors live in this executive part of your brain and that frontal lobe, there's a lot of issues with the early onset of people acting what you would, it's kind of an ableist term, but acting crazy. Like people think this is diagnosed as a behavioral health problem, misdiagnosed as a behavioral health problem.
Girl, don't start it.
So I can talk a lot about all those kinds of things. I don't want to get too far deep into it, but yes.
No, that's good. And I'm glad you used the term acting crazy, because I am a fan of using regular terms, using everyday terms that people understand, that people can relate to. And just think about it though, Katie, if a wife starts to experience, and I'm gonna get you to talk about some of the behaviors that someone with frontotemporal dementia displays, because as you stated, the personality lives in a frontal lobe. And so just, when she starts to experience those erratic behaviors, she's gonna relate to someone, Bill is acting crazy.
Yes. That's really what we saw. Okay, so just to back up a little bit, the reason that I'm a volunteer with the Association for Frontotemporal Degeneration is because my father, Steve Zenger, was diagnosed with what's called behavioral variant FTD, or behavioral variant frontotemporal dementia in January of 2014. But it took us about 5 years to get that diagnosis.
Wow.
So, and that's actually pretty typical. Like they think the average is about 4 years to even get the diagnosis of FTD. So that in and of itself is an awful and absolutely excruciating journey for caregivers and loved ones to see that there's obviously something wrong with the person that they love. Like my father, for example, would walk the same loop. We have some property in the woods, and that's where Dad lived. He was retired. He retired early, which was weird for him. Dad liked to work as a teacher. So that might have been one of our first signs. But he would walk in a loop with his machete in the woods and kind of like walk the same loop almost every day. So there are these behaviors that look like maybe anxiety or depression or apathy, but they actually aren't behavioral health disorders. It's that their brain is shrinking.
Wow.
Right. So it was absolutely weird to see that progression of my father. So my mother definitely didn't know what was going on at first. They were just going to get a divorce.
Yeah.
Yeah. Right. And so we didn't know what that was. And he didn't know what was wrong with him. He didn't realize that he was acting the way that he was. So it can be incredibly difficult for caregivers to experience this, very especially in those beginning signs, the beginning phases of the disease, because it is so early onset. You're not thinking dementia, right? They're not forgetting their disease. Right. Like you think dementia, you think Alzheimer's, which all is on this occipital lobe, is mainly where Alzheimer's is. And I'm sure you do a better job of explaining this.
No, you're fine.
But I always just think it helps for me to remember frontotemporal, that's this disease, early onset, a lot of behavioral issues, a lot of nerve issues, but then the Alzheimer's is that memory. But with FTD, that memory, especially longer term memory, is actually really well preserved.
Right. So, a couple of things you just stated about your dad, and your dad passed away.
So my dad just passed. He was diagnosed in 2014 with behavioral variant FTD, and then he just passed on the 28th of this year, 2021.
2021.
Yep.
So, definitely my condolences and our condolences to your family. But one thing that you just mentioned, early onset or younger onset dementia, we typically see someone will pass away more quickly than someone who's diagnosed with a progressive type of dementia such as Alzheimer's after the age of 65. And so the fact that you all were not able to get a diagnosis for 4 years really kind of took away 4 years of your life of being with him and preparing life with him with this disease. And so I think it's really important if you can share with us what some of the early signs and symptoms are. Like you stated with your dad, it looked like anxiety. He retired early, which was a little different, but you didn't think of that as any type of dementia or anything like that. So the early signs were missed because it looked like typical behavior for someone who may be dealing with something. And it may be really that he recognized some early signs of something not being right, but really kind of chalked it up to stress, environmental factors, sociological factors, or what have you. But what are some of those early signs to be aware of?
So early signs, so I do want to say one quick thing about FTD and that frontotemporal degeneration concept in the first place. There's two major categories. And so my dad fell into that behavioral variant frontotemporal dementia. There's also a kind called PPA, or primary progressive aphasia. And that's messing with these temporal lobes. So kind of super simplified is that the FTD is an umbrella term. Frontotemporal degeneration is an umbrella term for both of these two types of neurodegenerative diseases. One called PPA, which affects your language, but a lot of other things are still there. And then the behavioral variant FTD, which is what my father had, which again is that executive functioning, personality, frontotemporal lobes. Those are what's affected. So I'm really speaking to that today. I'm not speaking as much about PPA or primary progressive aphasia, although there are awesome resources on the AFTD's website. So we'll make sure to share.
That just means you got to come back on next time to talk about PPA, because I definitely want to talk about that.
No, it's fascinating. But it's excruciating. So if you're thinking about the first signs that come up with behavioral variant FTD, often what you'll see, like I said, was something that looks like a mental health issue, right? Acting crazy, acting abnormal. So my dad, he smoked cigarettes, which is not great, not healthy, not good for your brain or your heart. But he went from smoking maybe like one cigarette a day to compulsively smoking so much. So what it'll do is you'll see it mimic, they'll have compulsive behaviors that seem like they're really anxious and they just have to do the same thing every day, but there doesn't come with that like anxiety that you see with OCD folks. They can be very calm. So often what you can also see is apathy, so that they're no longer interested in the things that used to interest them, right? Again, rewatching movies, that was big for my dad, rewatching things or rereading books. Like I said, language is preserved with the behavioral variant for so long. So you're really not thinking dementia, because they can read a book, they can sit there and concentrate,
and they can know remember what they're doing.
What? Pardon?
And they can remember things.
Oh, and they remember. And my dad knew who I was until the day he died. Absolutely. So that's one of those major differences. You're not thinking about that, but they are acting really strangely. Okay. They can, say your loved one never gambled before, like never, wasn't an overspend, they always kept their finances right. They suddenly start racking up a whole bunch of bills, or they start gambling their money away, or start collecting a certain thing kind of compulsively. That can start to happen. You can also start to see some violent behavior or overly aggressive, or even like weird sexual behavior that you would have never seen before. Again, because all that stuff you learned as a kid, all those social norms, that's starting to break down. So sometimes you might remember it, but sometimes those neurons just don't fully fire, and you forgot that you're not supposed to say, "Oh, your hair looks like crap today."
Yeah. So like you just said, so that part of the brain that manages Cool. To say
Yeah,
that.
just manners, right? Like
Yeah. So,
social.
that manages that whole restraint,
Yes, yes,
that inhibition.
yes. That's really the best word for it, even though it's a big one. It's
Well,
the
yeah. So that, like you just stated, it's giving you, um, in my book, I don't even have a copy of my book here, but in my book, I wrote, you know, whatever comes up comes out, right?
right. Oh, I love that. Yeah,
Yeah, because
yeah,
the filter is not there, and people don't really understand how powerful the brain is and how much we depend on our brain because we're so used to having it, right?
right.
But you have to process everything, and so one of the things that I want to ask you, because what I've experienced with clients that I've worked with, trying to figure out what type of dementia they have, two things. But the first question is, what is the typical diagnosis process for frontotemporal dementia? I know.
So unfortunately, there is no typical diagnosis process. Because of our healthcare system across the United States, so don't let me get on my soapbox about this, and how we treat older people in America, that there is no typical diagnosis process, especially in the Southeast. If we're talking with people in South Carolina, there are not enough doctors to take care, or neurologists, gerontologists, geriatric psychiatrists,
Yeah.
to
Right.
even handle the amount of people that are currently afflicted by any of these issues, right? Any kinds of dementia. We do not have the healthcare systems in place. So it takes months to even get in with a neurologist that
Yeah.
might know what you're talking about or might not. So we had kind of a harrowing experience with trying to find the right neurologist who would actually give us a correct diagnosis. You might have bought, okay, just for anyone who might thinks they're already dealing with this, you might have gotten a diagnosis even 10 years ago, or actually even recently. Some doctors are still calling this Pick's disease. And so that if someone says Pick's disease to you, you need to go to www.theaftd.org, and you need to go look at the symptoms and go get yourself educated right now. Because unfortunately, what happens is that you become, as a loved one, as an advocate for the person that you love who has this dementia, you're going to know more than the vast majority of health professionals that you run into.
That is so
So
true. I'm
I
glad you
ended up
said that.
educating myself. I ended up making sure that I ran through all of the AFTD's resources on their website. I ordered everything. I watched everything I could, because no one was giving me a good answer about what FTD was, what was wrong with my dad. So I think doctors and nurses are doing their best, right?
Yes.
This is a rare disease. I'm not saying that this is this is something that people should be more aware of, especially as this entire group of boomers gets older. We
Yes.
really need to be aware of all these different types of dementia so we can help people. But I think that it's that diagnosis process is all over the place. What I guess I would recommend personally, I'm not a doctor, but we have been through this, and I have been trained by the AFTD. Try your best to get to a provider who actually knows what FTD is.
Mm.
So you can use the AFTD's helpline to try to find recommended neurologists in your area. There's also a list on their website of people by state. And it's not it's not perfect list, but at least there's a place to start where they know that doctor understands what FTD is.
So that is very important to note, because I like to give people information that's translational and transactional, and I like to leave people with resources. When you talk about these early signs, right, I think it's very important for people to really acknowledge the early signs. If there's a situation with your loved one or someone you really care about, and you have to like take a double take and you do something like, huh? Or I wonder why? Or, if you do that, I think you should consider what it could possibly be. And with blessings and with hope, it might not be that, but at the same time, you're prepared for if it is. And there's a resource and a place you can go. A lot of times, Katie, our families and our caregivers become very, very frustrated because they don't know what they don't know, right? And so this is one of the prime reasons I have you here, because I want to address areas that are blowing up, but people just really don't know about them. And as you stated, the medical professionals, and I tell people all the time, don't give them a hard time, right? They're doing the best they can with what they have. And I tell people, you know you, and you know your loved one way better than any doctor does, because you're in there for an average of what, 5 minutes?
Yeah. Yes.
So wherever you can go to get information, because you learn now what some of the early signs of first of all, you know what frontotemporal dementia is, or frontotemporal degeneration is now. Katie did a wonderful job of breaking that down and describing it. And notice she didn't say anything about memory. I will tell you, some of the clients that I've had who were experiencing or had been diagnosed with frontotemporal dementia, one wasn't at first when I started working with them, but the early signs for her were behavioral challenges, like really erratic behavior, a sharp shift in extreme highs, extreme lows. But the gentleman that I had, his early signs were, as you stated, executive functioning. What was happening was mail was coming to the mailbox, and it was you know how you get the flyers that says this key, you know,
Yes.
this is going to open a Ferrari. All you need to do is send in $1,000. And he started sending in money, and he was like a banker. And so that whole executive functioning process was affected. So do you see more personality changes or more executive functioning? Does it relate more to men or women, or does it?
Ooh, that's all. Okay, so it's actually pretty complicated disease, and like basically every 6 months they learn something new, right? There's all this new research being done. So a lot of this is like a moving target. But I think, so since this is like mostly caregivers that we're talking to right now, or people that want to be watching out for this stuff, there's not an either or. I mean, but if you see either, big personality changes, odd behaviors like that, right? Things that's like, that's never a decision that my brother would make. You know, he would never yell at the lady in the bank line, say something terrible to them. You know, if you see something that's really erratic, start watching more closely for those kinds of signs, for those personality problems. Because actually, I'm glad you mentioned the thing about the executive functioning and the being more susceptible to like basically scams. So what'll happen is with FTD, again, you've got that 4 years or so of people trying to get the diagnosis. But during those 4 years, those people, the person with FTD can look totally normal. Like they can still act very, very normal for the majority of their interactions. But if they are doing something like that, where you see them being more susceptible to scams, this actually happens a lot with the FTD community. They said, my husband like blew all of our savings, and we didn't know. It was 10 years later, and there's all this debt racked up, and we didn't know anything about it. Or they quit their job, or they were doing badly at their job, but they had no idea, right? And so, and it can be, there can be some big surprises that come up for family members that can be really hurtful. But so, and we can get into this later. I don't know how much you want to talk about like dealing with it as a family member, but I think
let's get into that. Let's get into that now
before we,
because we're going to wrap up with resources. But what tips do you have and strategies do you have for families? Because I'm telling you, this particular type of dementia is very unnerving for family members. It's heart-wrenching. It's scary, especially for the family dealing with it. But as an advocate and as a gerontologist and care manager, like I am, I'm a court-appointed guardian as well. And so, you know, there have been cases of financial exploitation that really weren't, because, you know, what you're talking about and what we're talking about today impacts all areas. It transcends the family, but everything that is ingrained, you know, in a family system, in terms of being able to manage care, typically, it doesn't go out of the window, but it kind of takes a back seat, because now you got to be innovative in your care.
You really do. There's a lot of environment. So I know you talk about this in your classes, but like in your resources, but that environmental, like that situational caretaking is really important. So eliminating, so my dad would eat, he had the problem with impulse control, and he would eat a box of honey buns or a full thing of brownies, and he would just go back and eat eat it all day long, right? Or again, with the cigarettes or whatever. Environmentally, if you can remove those things from the environment, then they'll find something else to focus on. But if you can remove those things that could potentially be dangerous, or if you please remove all the alcohol, right? Or my dad unfortunately didn't have an issue with that, but you know, anything that could potentially be an issue, remove those things from the environment. I'll also say on the personal side, from a caretaker's perspective or from a loved one's perspective, this is hard, but they're going to do things that don't make sense, that they're not the same person that you love and loved. However, in order to take the best care of them, you still have to love that version of them, right? And so the more quickly that you can get to forgiveness for this, the better off you'll be. And I know it's hard to force that, right? The forgiveness piece, but truly their brain is shrinking and they are not doing this on purpose, but it feels, to the person who loves someone so much, it can feel like it's so personal.
Right? Like it's an attack.
Right, exactly. And then sometimes I'm not downplaying some of the issues. Like, so, again, some people can become violent, right? Like, so I don't want to say that the caregivers, you know, aren't telling the truth when they're saying they're being literally attacked. Like, sometimes that unfortunately is a real thing, but you just want to try to take it away, to not take it personally as fast as possible with this disease in particular, because it is not about you. They really, really don't know what they're doing. There's something called, what is it, anosognosia? Oh,
I never heard that.
Or I think I'm probably saying it wrong, but it's like they, with behavioral variant FTD a lot, they don't know that they're acting weird. They don't understand. They have no idea that they have dementia. They think they're fine.
That's their normal. That's what's normal to them. And as you stated, it's not about the caregiver at this moment. It's not about the family. It's all about the person whose brain cells are deteriorating. Your dad and others like him, they're doing the best they can with what they have. I love that you said, get to forgiveness as quickly as you can, because you have to forgive before you can care. Katie, I know that your association has some great resources. I want you to tell us about your resources, because the way that family members can get to forgiveness is to first understand the pathology and just the basic nuances of the disease process and how it affects behavior and connecting to groups. And so I know you got that covered.
Well, so this is the big thing. This is very important. A huge reason why I want to come on here is because I would not have survived this process if it wasn't for resources from the AFTD. I got connected with them through their caregiver groups, and the AFTD trains specifically people who have been through this process or caregivers like you to run these care groups, caregiver support groups, where that's specifically about FTD. Because if you try to go, this happened to me, if you try to go get support through an Alzheimer's group, you're going to feel totally alone. Right? This is not so different, so fundamentally different. So being around other people who know what you're talking about when you talk about FTD and the experience of losing your loved one even before they're gone, that will help to heal you. I swear, I promise. And there are incredible resources there. So if you go to www.theaftd.org, you can go to your state and find your caregiver support groups. There's a virtual one run by the wonderful Mary Rebels here in South Carolina. She's trying to get it back up after coronavirus stuff.
But we'll tell her we're here to help her.
So I'm gonna put her email and everything in the chat so y'all can connect with her if you need to. She's phenomenal. And again, like I said, these are well-trained people. The AFTD provides free training, so you can have free caregiver resources so that you can actually connect with folks that are going through the same thing that you are. And I'm telling you, in order to survive this, you have to be connected to other people who know what's going on and have compassion for that.
Absolutely. I agree 100%. Katie, will you hold up a couple of those pamphlets? And these pamphlets are free. These books are free.
You can find it on the website for free, and then you can request these materials from the AFTD online for free. So this is a really good overview about frontotemporal degeneration. We also have you can join the mailing list. You don't have to face this alone. There's great volunteer resources. You can contact me, Katie Zenger, Zenger at theaftd.org. I'll put that in the chat too. If you need a presentation to a caregiver group or to anyone, group on aging, anybody that wants to hear about this, I'm happy to do presentations about the disease. We also have incredible work done by the University of Pennsylvania, their school. They have this, there's a lot about genetics in FTD.
Wow.
That's really important for people to understand, but it's complicated, so I don't want to go into that today.
Maybe we can talk about that offline.
Yeah, well, like it's a lot, and but the genetics of FTD, if you do have a loved one with dementia in your family, you really need to have an understanding of that and what that looks like. And then just like, they're just phenomenal resources. Like, what do you do? It says it's FTD. Now, what do you do?
Yeah.
And caregivers really need help navigating this world because it is not the same as Alzheimer's. It is not easy. It's incredibly individualized because
Yes.
everybody has their own individual personality.
That's true.
And
good point.
So not one case of dementia is just one case of frontotemporal dementia is just one case of frontotemporal dementia. It's not going to look the same as your patients, as my dad. So my dad was my hero. We have the same birthday.
Oh, wow.
He was, I'm definitely daddy's girl. I love him with every bone in my body, but I had to learn to love every version of my dad.
Every version of him. And I tell people, all the time, that's still your dad. That's still your loved one. They're just responding to things differently from what you were used to, but that's still the person modified. That's all it is. And so, Katie, I want to thank you for being here and sharing your personal story and also sharing professional resources with us. Thank you for being the caregiver that you were and the caregiver that you are now, because as advocates and educators, we are advocates. And so your experience with your dad, honey, has made you just a force in the industry. And I just value you. I value your organization, and I value the work that you do. And I'm so thankful that you decided to come on with us. And I think we're going to have you back. And look, so in honor of March's Women's History Month, The Future is Female shirt.
Ooh, I love it. Yeah, and I'm wearing my AFTD red.
There you go.
To match this like bright red color.
Yes. And I just appreciate your energy. And so for those of you who are viewing us live on YouTube and also on Facebook, go ahead and drop your questions down below. Anything you want to share. We'll also drop Katie's information and those resources because we need for you to head over there immediately. All right. Thank you again so much, Katie, and thank you all for joining us. Until next time.